right now, in that one of the charges to academic medical centers is to figure out how well we're doing delivering care in smaller communities and measuring outcomes, if you will. And the federal government is now shifting its center of gravity of funding in some ways towards what's called patient-centered outcomes research. And the PCORI, Patient-Centered Outcome Research Institute, and OHSU now putting together a School of Public Health in partnership with Portland State has a keen interest in figuring out how we're doing working with communities in distant locations and measuring how well care is being delivered and what works and what doesn't work. And so as we develop this relationship and get kind of our legs under us on the clinical delivery side and we start to turn towards education, part of the benefit I think we'll be having students and residents here learning medical knowledge, but also having researchers learning about how care delivery works in a rural area. And they're doing a lot of that research now, but I think this is an opportunity through a closer partnership, common electronic medical record, where data mining would be much easier. And those kinds of things I think will help augment the research growth.
Yeah, and just to, again, reference the family physicians that Dwayne mentioned, by becoming part of the department at OHSU, they will have access to the full, range of research activities and be able to be involved in ongoing studies. Again, in a way that without a common medical record would just be impossible.
Yeah, we live with this every day, so it's a little easier for us to talk about. But we literally at MCMC, we have worked very hard, obviously moving to a digital profile in terms of everything we do. But I think at last count, we have somewhere in the neighborhood of 7 major IT systems that we're maintaining.
Oh, right.
It just becomes untenable, especially in terms of where you need to go and the ability to data mine, the ability to track what you need to track, maintain regulatory compliance and everything else that we have to do. And it just becomes prohibitively expensive to continue to try and make sure that that's all running, and you've got the different systems that can talk to each other because you have to write interfaces because everything has to work. Being on one common medical record, both in an in and an outpatient setting, and the ability to trade and transfer that data and that information on a common platform is just huge.
Is there a timeline you're projecting that you'll be able to get this completed?
We're shooting for about 18 months. We're starting that process right now and looking at completing the transition in approximately 18 months.
That's amazing.
It's a big job, yeah. Check with my IT guy here in about 12 months.
Right.
We'll see if he's still alive.
I've been thinking about it, but when I started thinking about it, I had black hair.
Yeah, that's about right.
Okay.
Any other questions?
Is there anything we haven't asked that you would like us to cover that we haven't covered so far?
I can think of anything. I think it's pretty comprehensive. Hopefully we'll give you something you can talk about or write about.
Yeah,
Well, we do appreciate you coming.
we do.
Did you have any question, Kathy?
Oh, I think
don't
you
wanna cut
answered
you
it,
off.
as when I thought back, you had pretty well answered it. so
Okay.
thank you.
All right.